And just like that, we're live. Okay, well, hopefully all the people who were here a half hour ago when I was testing this come back. Instagram, you better get it together here because it says I'm connected, but I don't see a feed. So I'll wait on that. Okay, well, happy Valentine's Day, guys. February 14th, we're in the middle of February already. How did that happen? This is actually a big day for a lot of things other than Valentine's Day. It's also the beginning of Family Violence Prevention Week. We're doing a lot of content with Third Place Transition House. Actually, we just posted a blog about their services here in Truro, as well as what they're doing for Family Violence Prevention Week. So head over to trurobuzz.com and check that out. It's also the start of Random Acts of Kindness Week. So starting today for the whole week, it is actually a national thing to perform random acts of kindness. So we at Truro Buzz are going to be doling out some random acts of kindness to our followers. So if you are a follower on Facebook, Instagram, Twitter, or our email newsletter subscriber, we are going to be drawing random followers all week for prizes that we have hanging around the Hive, just to make your week better. And hopefully, if you're a winner, even if you're not a winner, you're going to pass on some of that kindness to someone else this week. Instagram, you're still saying no signal. Sorry if you're over there. Okay. Well, we're going to trug along anyway, because we have a lot to talk about tonight. Not only is it Valentine's, not only is it Family Violence Prevention Week, and not only is it the beginning of Random Act of Kindness Week, it is also National Organ Donation Day. And this is something that needs to be talked about, mainly in Nova Scotia, because we've had some big changes to organ donation here in the province, and the first province in North America to have this kind of policy change. But we are going to introduce the first of our guests right now. Now, bear with me here. This is the first time I've used this platform. Hi, Dana. How do you get an email address? If you're an email subscriber to us, and you can head over to trurobuzz.com, and you can enter in to subscribe to our newsletter there, or on Facebook on the left side menu there. It's, I don't know if it's changed with the update, but you used to be able to subscribe to our newsletter on Facebook as well. And we can go through our database of email subscribers, and we're going to draw people from that list to win prizes this week. So if you're not signed up, head on over there and grab our newsletter. Why do I still have no signal on Instagram? Okay, hang on 1 second. I'm going to see if I can fix this real quick. I don't know if I hop. Oh yeah, no, can't do that. Well, shoot. Okay, all right. I'm going to introduce our first guest tonight. This is also big for Truro Buzz. I'm going to introduce you to our newest Hive member. He hasn't started yet, but will be starting with us very soon. And we've also decided to tie in this introduction with National Donor Day because they have a great story to share. So, hello, Craig and Rod.
Hey, Alicia, how are you?
Good. Thank you for joining us tonight. Yeah, I was so close. I had the test working earlier, and now I cannot seem to get Instagram to connect. What a bummer. Okay, so guys, thanks for joining us tonight. It's really lovely to have you. And Craig, welcome aboard.
Well, thank you, Alicia. I'm excited. I'm super excited. I came all the way from Ontario for this job, so you know, I want to hit the ground running, and you know, in the meantime, me and Dad are just kind of chilling out in Earltown.
You are chilling at are we allowed to say where you are?
Yeah, we're chilling at the Grace, the Grace Community Arts Center.
Grace Jolly in Tatamagouche.
Yeah, so I want to thank Marshall for giving us the opportunity to do this here. This is in a fabulous space, and they got an art show going on right now. You can see some of the art behind us, actually.
Yeah, so we are big fans of Marshall and the Grace Jollymore. So shout out to him. Thank you so much for sharing your space tonight to make this happen. So why are we talking to you guys today on National Organ Donation Day? Why is this something you wanted to share?
Well, it just so happens that Dad and we've gone through a successful transplant. So we're going on close to a year now.
June the 11th.
June the 11th, we had a transplant, and I gave Dad 61% of my big liver. They said I had a big one, and they were, it worked out. So we're happy to be here. We're super happy to be here.
It's actually pretty incredible that you're a match, isn't it? That's not always the case with family members, or am I wrong with livers?
It tends to be with livers. I think it tends to be a sibling or a family member that ends up being one of the donors. It tends to be percentage-wise, up there in terms of compatibility. So when Dad was diagnosed, and that was
Several years
ago, I immediately did a little bit of research, and I knew that because of the better chance that I would need to do everything I could to ramp up and do this. So, it was a lot of hard work, but we're here. So, it paid off.
That's awesome. We're so glad to hear that. Okay, so we're really happy to hear your story, but I also have to bring on our next guest who can add a little more on the background of organ donation and the new policies that we have here in Nova Scotia, which is super important. I actually didn't know about this until you had shared your story with me.
Mm-hmm.
So without further ado, sorry?
No, go ahead. I don't want to interrupt the introduction. Go for it.
Okay, we are joined by... Okay, we got there Dr. Stephen Bede. Thank you so much for joining us this evening.
Well, thanks for the invitation. Happy to be here.
Oh, we're so excited to have you. There we go. Okay, I think this is a good ratio here. Now, for people that don't know, you are the medical director of the Nova Scotia Organ and Tissue Donation Program. Is that correct?
That is correct, yes.
Awesome. And in January, this last month, we were the first province in North America to pass legislation stating that all Nova Scotian residents will be considered as having agreed to be a donor after death, unless they choose to opt out. Like this must be a game changer to your program.
Well, I think there's two parts to what's changed. Clearly, the law is the law, and that's important in its own right. But the other part of bringing the law on board was a conversation with the Department of Health about how, if we're to be successful, the law needs to be more than just a cluster of words on a piece of paper. It has to be an opportunity for us to essentially completely reboot the provincial program so that we can support what we expect to be an increased volume of referrals for donation when the law comes into effect. So the proclamation was several weeks ago, but we've been working towards this for some time. And between the reboot of our program and the change in the law, we're hoping to be very successful.
That is incredible. So I know I myself didn't become an organ donor on my license until sometime in my late 20s, and I'm not even sure why. I think it was just something I hadn't checked off or hadn't thought to do. So I imagine a lot of people, very excited. Thank you for sharing this information. Thank you for joining us. I think a lot of people would be curious to hear how this works. In the event, I know in the article I read from CTV about this update that there have been issues with people who, I don't want to say defied the wishes of the person, but there were families that wanted to opt out regardless of what had been selected on the person's own medical paperwork. How does that work together now?
Well, we have had a registry in Nova Scotia for some time. So for people who supported donation and wanted to officially register their intent to be a donor, we've had a tool in place for some time, but it wasn't considered binding. So what we found happening more frequently than we would like is that if somebody would meet medical criteria to be a donor and they indicated they did want to be a donor, it was there and registered, we would still be approaching the family for a consent. And it was not uncommon that the family would refuse to provide consent, in spite of the fact that the wishes of their loved one were known and registered. the family, for whatever reason, would not provide consent and donation would not proceed. That is one of the things that we expect to change with this, because when we deal with this in the new situation, the expectation is that people will in fact be a donor unless they have registered that they want to opt out. Now, a conversation will still be held with the family, but the questions we ask are different. But one of the drivers for this change was the fact that there were probably around 10% of people who said they wanted to be a donor had families that refused to provide consent.
I see. That's got to be a hard issue. Rod, if you don't mind me asking, did you have to wait very long when you found out you were sick to the point that you found out Craig could be a donor for you?
Well, yeah, I think it actually goes back almost 15, 18 years ago when I was first diagnosed with liver issues. And it was a result of other failures. And progressively, my liver function, that became decreasingly worse. And it's about 7 years that was the timeline from the time that I was inevitably told that I would have to have a liver transplant to the actual day that we had the transplant. And I believe Craig was in training for about 3 years, going through a process of getting prepped. And
Really?
Well, yeah, I mean, it wasn't training like Rocky. I wasn't taking like wood out to, snow, but it was daily walks, and then just eating properly, and then cessation of alcohol. I stopped the day Dad was diagnosed, and I figured that it would be the thing I would need to do. And then when you ramp up to do it, you want to make sure you're not consuming marijuana for about 4 weeks before, and then 8 weeks after the surgery as well. You're not consuming those things because that can run the risk of blood clots and things like that, and complications. And Dr. Beat, if I say anything wrong, please step in and let me know. I'm not an expert, but I did go through the process. So, but yeah.
That's really, see, TV has ruined us, right? Because I assumed it's like, oh, do a test, you're a match, hop on the table, let's swap these organs out, no problem. There's actually quite a process involved to donate. Is that true?
Yeah, there's phases you go through. So in phase 1, it's blood work to check compatibility, and it was a bit of a scare for us because I was an A negative and you were an A positive, and I didn't know if that would be compatible, but it just so happened that he's positive, I'm negative, it doesn't matter. And that was a misconception that I had about blood compatibility. And then phase 2 were things like your EKG, or you get a chest x-rays, you get MRIs done, you get all sorts of stuff. And then sometimes they do biopsies. So I was lucky to have a liver biopsy done because they saw just something elevated or something different. And so they went and they took a biopsy, and everything came back okay. But then you throw on top of that another thing, which was COVID. And COVID was happening in the midst of all this. So we were in Toronto, going to Toronto during the first wave. It all happened during the first wave. Very scary. We would go, it was almost like going into an empty city and going into these hotels. It was like The Shining. It was like this empty hotel. And we were always worried about getting COVID, and we got lucky. I think we got really lucky, and yeah. So there was a lot of hurdles we had to go through to get here, for sure. But that said, like it was an incredible process, and the team in Toronto guided us the whole way, and we always felt safe. We always felt that they were looking out for us. So that's important to mention as well.
Dr. Beat, I saw in the same article I was reading that there's generally more than 100 people waiting in Nova Scotia alone for transplants at any given time. We just had a comment from Shelley Lyons that said she's been waiting for 6 years. Is that a high number for our population?
It's probably lower on a per capita basis than it would be in other parts of the country. Uh, and that's a good thing and a bad thing. On the one hand, it's lower probably because the system, once you've been identified and put in the system, is supported by a donation program that's been pretty successful. But the flip side is that it might be that there are people out there who have chronic illnesses that could be well treated by transplant that haven't been identified and referred yet. So when we look at our numbers, we think there's more people in Atlantic Canada who have end stage organ failure, like liver disease or whatever, who could benefit from a transplant than the numbers are on our wait list would suggest. So it's a bit of a good news, bad news story. Overall, it's very accurate to say that there's, in Atlantic Canada, there's, between 300 and 400 people at any given time who are awaiting a transplant. And the Nova Scotian numbers are roughly 100 people that we know are on the wait list and are actively waiting. And they're living a life that can be quite a challenge. People who have end stage organ failure will know that their lives can be quite difficult. So you are alive, but that doesn't mean that you're living that sort of TV version of life, as you alluded to. When you have chronic kidney disease or liver disease, it can be tough.
I can't imagine. I've been incredibly fortunate in my life to not have had anyone awaiting any kind of organ transplant to this stage. So, and I realize that is more of a rarity these days. Well, we had the one follower that says she has a hemodialysis for 6 years and fighting to get on the list. So is it a struggle even to get on the list? Like, you have to be at a certain point to even get on the list to be considered?
Well, there's a variety of factors that go into a decision around whether you're a candidate for a transplant. And I wouldn't know off the top of my head what the issues might be for a particular patient, but the need for support with dialysis is common, and many, but not all, people who are supported with dialysis would be considered as transplant candidates. There may be some medical or other reasons why somebody who is getting hemodialysis is not yet specifically listed for transplant.
Now, as Craig said, of the time period it took from him being a match to go through these testing, is that common for most transplant issues, that you have to have this from the point of finding someone that matches, you have this amount of time before you can actually donate the organ?
No, they're in a bit of a unique situation, in the sense that they went through a living liver donation. Toronto, I believe, is the busiest living liver donor program in the world.
Yeah.
And so, if you are doing a living liver donor, you really need to have that done in a high volume center. As they can tell you better than I, this is not a small operation. In the small, medium, and large category, this would be an extra large, and which is why the healthcare team would be very careful that the donor is in pretty good shape, because we're asking a donor to put themselves through a really big operation for usually the best of reasons, to save the life of your dad, but it's still a very big operation. And so the assessment has to be pretty complete. You don't want to have somebody whose best intentions are to donate the liver, but in the process, that's such a difficult thing for them that they die, or they end up with major complications. And so the timing on when that happens is dependent on the workup for the donor. But the other thing that drives this to some extent is how sick is the potential recipient. And with chronic liver disease, you can have a journey that can last some years, or there will be some people who will have acute decompensation, and they will go from living their life to being in the midst of a crisis within days or weeks. And so the situations vary a little, but a living liver donor is a unique circumstance. And we don't do that here in Halifax. We have a very busy deceased liver transplant program, but a living liver transplant program is really something that needs to go to a specialized center like Toronto.
And they've done over in Toronto, I know, Alicia, they've done over 800 of these since the year 2000 living donations. And they're the most experienced and successful program. But it's in that combination of the living donation and the deceased. Dad was on both lists. So while we were ramping up on the living donation side, he could have got a liver from someone else who might have passed. And I think actually we came close.
Yeah, I was put at the number one spot on the list at one point in time because I was quite sick for a couple of years actually, and in the latter stages, certainly in the last year, things got progressively worse. I was hospitalized on several occasions. I had other life-saving surgeries, and then in the process, I was having paracenteses done every 7 days with extractions of 7 to 10 liters of fluid. I had a lot of ascites and delirium, and I was quite sick, as the doctor alluded to, for some time. So it was quite critical, the timelines that we were faced with getting this surgery done. And
it's actually pretty remarkable to see how great you look now compared to the person you're describing. I mean, I'm very familiar with this, but most people could not appreciate how you can go from being so sick to looking really pretty great right now.
Oh,
it's been an incredible journey, and the recovery and the rehabilitation has been unfounded. The doctors in Halifax and in Toronto can't believe progressively, both physically, emotionally, in all respects, I've done incredibly well in my rehabilitation. In fact, I also had diabetes. Along with other organs that were compromised. My lymphatic system was compromised. My kidney function was quite compromised as well. All those things. My kidney function is perfect again. My liver enzymes is elevating incredibly well. I'm no longer on insulin. I was on insulin for almost 10 years with diabetes. I take no medication for my diabetics anymore. I'm physically active, living here in Nova Scotia. And, it's been just an incredible journey of rehab.
I just want to jump in here real quick. If anyone's just tuning in, we see the viewers coming in. We're talking with Dr. Stephen Bede, who is the medical director for Nova Scotia for the Organ and Tissue Donation Program, and Craig and Rod, who it must just be coming up on a year, is it now, since your liver transplant?
7 months. It was in June. It was in June 11th.
Yeah.
That's incredible.
I was back home in Ottawa on July 22nd from rehab. I had to do rehab in Toronto because I was still quite sick post-surgery, of course, with my brain function and physical function and so on. Came back to Ottawa, and we said it's time to get out of Dodge City, and we skipped Dodge, came to Nova Scotia, and started a new life.
That is incredible. Like, I have goosebumps so hard. Like, what a fantastic story. Dr. Bede, I don't know anything about the recovery from major surgery like that, but it blows my mind to look at him now and say that it has only been that long since he had this surgery.
It can often be incredibly dramatic, especially with patients who have, late stage liver failure. Some of the complications you've talked about, we're very familiar with. When your liver is not working very well, some people become essentially comatose. They're in a deep coma, and then you give them a liver. And I've had patients who were in that situation, and they wake up within a few hours of surgery, and their families sort of stand there and say, we haven't seen them this clear for years. So when your liver does a whole bunch of things, and when a new liver starts clearing your blood in a way that your diseased liver was never able to do, a whole bunch of things can get better. Now, it's still major surgery, and it's surgery that's typically been done on somebody who's been sick for a while. So, I mean, the recovery period does take quite a while, but people will start to make tangible, identifiable gains very, very quickly when the new organ starts doing what it needs to do.
The thing about the diabetes no longer being present, that blows my mind. Is that a common occurrence?
No.
Nope. It's great that it happened. Yeah.
Rod, you little miracle, you.
Yeah.
He is.
Yeah.
He is.
That's fantastic. And how long were you a diabetic for, if you don't mind me asking?
About 15 years.
Oh,
I was on metformin and other forms of medication.
He ate a bag of Humpty Dumpty chips in the car on the way over here.
my mind is blown. I mean, I recognize I have very little knowledge on the inner workings of this, but my goodness, like what a new lease on life from 15 years of diabetes. I mean, that is incredibly, I don't want to say debilitating, but it really restricts, I guess, depending on the level of diabetes you have. And to now, like, what is that even like?
See, I was very mobile. I had rollator walkers, and I couldn't walk. I couldn't. This was a year and a half before even my surgery. I was debilitated to that point, and
Yeah.
I'm not running yet, but I'm getting there.
So what happens is with the liver, when it doesn't filter out the ammonia, like your blood, like Dr. Bede was referring to, it goes to the brain and it kind of poisons your brain. And you start to present like almost like an Alzheimer's or dementia like state sometimes. Dr. Bede, I don't know if that's correct, but dad was not himself. He was a completely other person, and his memory I think is affected a little bit from it. But it was a big window of time that you were,
About 2 3 years.
2 or 3 years.
Yeah.
Where and
I'm not surprised at all that that's the story that you're describing. That's why, to some extent, people have this Hollywood version of what the whole process is like. You're sick, you go in 48 minutes plus commercials, you leave the hospital and everything's perfect. And that's just not the real world. People who are awaiting transplant are dealing with a lot of health challenges. Life is tough in most cases when you're awaiting a transplant. And so if a family have made the decision to donate, it is transformative for the recipient. And it's in the midst of what you can only imagine is the worst days of somebody's life as they say goodbye to a loved one who's become a donor. There is no good news in that. There's none. Our donors they typically come from one of three categories. You either have a severe traumatic injury to your brain, like a car accident or a fall. You have a huge bleed into your brain from an aneurysm or a stroke, or sometimes you have a condition where the oxygen to your brain is stopped, like a heart attack or a drowning. So if you think about it, the people that are donors with that kind of a circumstance, generally speaking, have this sudden catastrophic something or other. So their family and their community identified them as normal and healthy that morning at breakfast, and then they're getting a phone call later the day to say there's been a terrible accident. So these families are absolutely overwhelmed by the sudden and catastrophic illness they're dealing with. And there's no good news there, but the chance that saying yes to donation might provide a legacy for their loved one, it would save the life of a number of people. That's the only positive in the middle of what's nothing but bad news. And when you talk to donor families, the fact that they were able to find something positive in the middle of their tragedy is an important part of their healing. It's a really important part of this that most people don't think of. If we talk about trying to support a system, they always see the benefit to the recipient, which is obvious and important, but this is something that can help a donor family who's going through the worst thing you can imagine. And that's really the reason I got involved. When I'm an intensive care physician dealing with somebody who's got a terrible injury to their brain, I have no idea who the recipients are. They're not my patients. In a specific sense, I don't care. But the donor and their family in front of me are my patient, and I do care. And if we can do something to help them provide better end of life care, we need to do it. And of course, somebody will benefit with a life-saving transplant.
I am just reeling over this information. Like I'm gonna have to, when this live is over, I'm gonna have to go back and watch it a few times because this is blowing my mind. We did have a question there from Shelley. It said, "Why did it take so long for the process for his transplant?" And I think it was, you said, because it was a living donor transplant versus a death one. Was that correct, Craig?
Yeah, well, Dad was sick for a lot longer. He was sick for a long time, but he only got his official diagnosis about 3 years out from when the time that we had the surgery.
Yeah.
And
That's right.
and of course, it did take a little longer because of COVID. Now, COVID slowed the process down. We didn't know if transplants were going to get shut down
Oh my God, of course.
so because other transplants were getting shut. We're stopping. So that was a very big concern of ours. But luckily, they kept going. I know that the number of transplants were fewer, but they were still doing them. And we were lucky to be in that mix.
Well, they were doing in the midst of interestingly, in the midst of our pandemic with COVID, donation activity has plummeted around the world, and transplant activity has plummeted because so many ICUs are filled with people who are dying from COVID. There's just no room in the ORs or the ICUs. So the only transplants that continued were the ones that were literally to save a life. And somebody with end stage liver disease would fall in that category. But somebody who is being supported on dialysis is still being supported. And so transplantation rates dropped dramatically, as did donation around the world. Now, interestingly, Nova Scotia, as I sort of spoke to you earlier, as we were rebooting our program here, we were doing a lot of work to enhance our donation program, and we were incredibly busy. We had by far the highest donation rates ever recorded in the country in the middle of a pandemic, which is a remarkable testament to our team, I think. But overall donation activity has been impacted by COVID, and transplantation activity had to decrease because our ICUs were filled with COVID patients in most of the country.
We have a question. Are they doing transplants in Halifax now during COVID?
We always did transplants through this if it was, for example, a liver transplant to save somebody's life, but kidney transplantation was put on hold for a while. For some time now, especially since Nova Scotia has done so well from a COVID point of view, we have been we've been very busy with our transplant program. So we've been actually remarkably busy for some months now.
Yeah, we definitely have been very lucky in Nova Scotia. I'm actually originally from Newfoundland, and most of my family and friends are still there. And of course, they're currently having their second wave now, and it's almost surreal as they're going through I want to say the shock, but I guess the COVID anxiety we went through back in like before Christmas. So I'm like, no, you'll be fine, guys. You'll be fine. We're on the other end of it. Just don't worry about it. But you forget how it felt in that moment. And we're a little less affected here in the Truro area than you are in Halifax, whereas they're all at the city center that are going through that. So I'm curious how that's affecting their hospitals there now with such a large spike of cases so quickly.
Well, Newfoundland's struggling. We're fine. Nova Scotia, when the dust settles, if things don't change in Nova Scotia, somebody's going to write a book about how we got through this with so little COVID when the rest of the world has been struggling. But having said all that, I'm under no illusion. As good as things are now, we can get out of control very quickly if we don't pay attention.
Yeah, it's scary the amount of contact you can have so quickly. I think that was the biggest thing that COVID showed us, how interlinked it just takes one person to go, well, here in Truro, we had a rotational worker who they went grocery shopping. They did, all the things that they had to do, and then later became positive and I don't think we had a spike in cases from it, but it just, as soon as you contact trace one person on one day and see how many people they potentially had contact with is mind blowing.
Mm-hmm. You're right.
Hi, Craig and Rod. We're watching from Gas. That's Ellen Connolly. I don't know if you can see the comments there.
Hi, Mama.
Dr.
Go ahead.
B, sorry, go ahead.
No, go ahead. Go ahead.
Dr. B, did you say that you work in intensive care with the donors?
Yes. Well, I work in ICU, so anybody with a severe brain injury or might be a candidate for donation would be the type of patients I'm taking care of. But sometimes a very sick liver transplant recipient might need the ICU, and all of our liver transplant patients go to the ICU. So depending on the week, the ICU where the donors are is different from the ICU where the transplant recipients are. But depending on the week, I may be taking care of a donor one week and a recipient the next.
I ask because I'm curious if it's too soon for those who are waiting to be recipients to be excited or have renewed hope with this new law for Nova Scotia.
I don't think it's too early to be excited about the fact that our system is getting better, and that investment has been made in improving it, and that we're trying to be creative to address the gap. But to translate that into the notion that wait list is going to plummet and organs are going to be available, tomorrow, is frankly not going to happen. So the idea that for some years we've tried to improve the system and it was hard to get traction, and now we do, is wonderful. And the way we're doing it is unique. That's a good thing. But I can't tell people who are waiting for an organ that the problem's solved.
Of course. There was a question of, while there are limited transplant operations happening now during COVID, what happens with the donor organs during that time?
Well, now we are back to normal. We are doing full transplant quota now. When we had patients that were donors and transplant programs were shut down, we were still able to donate livers because that would be considered life-saving. Lung would be life-saving. And to be honest, what we were able to do with some of our kidney donors was address people who were especially challenged. There's a thing called the highly sensitized patient list. What we know is that certain people produce antibodies in their body that make it really super tough to find a good match. And oftentimes it's women of childbearing age who have developed those antibodies. So we know in this country there's a group of people who are what we call highly sensitized. And if the typical wait list might be 3 years, we've put a plan in place to address that group of patients who might have waited 10 years. Well, during COVID, when we had a donor, we still made sure that that group of people, the highly sensitized, they still got a kidney if they could. We actually had several pediatric recipients, and even though it was COVID, we said a pediatric patient is going to get an organ, period. We're not stopping that process. And so we slowed down some kidney transplantation, but we still addressed the people who were really in crisis.
Now, being that Nova Scotia is the first province in North America to adopt this approach, are we likely to see it continue in other provinces and states throughout North America?
Well, that's a great question. There is a lot of interest, and I mean that not in a general sense. in a very specific sense. I've been involved with some international stuff and presented some of our stuff in Korea in a national meeting in Winnipeg. Um, I deal with another group that is international, and the world knows that we are the first in North America to do it. And our Canadian colleagues have been watching very, very closely. One of the things that people who generally support donation think is that if just every single person was a donor, we'd solve the problem. And so there's been political pressure for everybody to go to presumed consent. We were the first ones to do it, but I know provincial departments of health are watching to see how things happen here. And we're studying what's happening. We have a large 3-year Health Canada grant to study our system. And the lessons we learn will answer that question. We could very well be the first, but in a few years, maybe everybody in Canada will be doing this. That is quite possible.
Wow, that's amazing. And I mean, this did take some time. Like the article I was reading about it said it was unanimously passed in April of 2019, but it was only now implemented in January of 2021. Is that very normal for the time between voting it in and actually implementation?
No, we were delayed a little again because of COVID.
Right.
What we had was unanimous passage of the legislation, but we knew from other countries like Wales, the UK, Belgium, who have brought this on board, that if you change the law but you have not educated the healthcare community or the public at large or gotten your healthcare system ready for it, then it will fail. So our design was to have it passed and then work on changing our system before officially proclaiming things. And then when we developed that plan, we got hit by COVID, and that delayed things by at least 6 months. But that time was crucial because it enabled us to work on system change.
Blessing in disguise almost.
Actually, yeah, you're exactly right.
Rod and Craig, do you think if this had passed in Ontario, do you think this would have, I don't want to say taken care of things quicker, but do you think you might have gotten this result quicker? I don't know if that's something you can even speculate on.
I don't think so.
I don't think so. Because we were part of the living donation track. That was just the choice that we made together as a family, and so we didn't. But I'm trying to think now. Like,
well, where you were on both lists, I wonder if this had been implemented, could you possibly have? You possibly could have been.
Absolutely,
Oh, yeah,
absolutely,
sure.
yeah.
Yeah, there's only more opportunity and potential donors. Yeah.
It's a wonder how many people just don't think to check that box when you're doing your license, right?
Right.
We do have a question there, Dr. Bede. Speak to the number of physical factors that have to match between recipients and donors of liver transplants. How many livers donated cannot match someone who's waiting?
That's a great question. The most significant, if we assume that the liver is anatomically normal, and that's not always the case, but if it's an anatomically normal liver, then the most significant influence is going to be the blood group. So if somebody has a common blood group, then the chances that there's somebody on the list who will need that organ are pretty high. And the distance that you can move a liver is significant. We can get to the middle of the country. So there's a couple of things. If somebody were to donate a liver in Nova Scotia and there's nobody in Atlantic, Canada that it would be a good match for, we could cool the liver and send it as far west as Manitoba. So if somebody was in central Canada and needed that liver, it would be transplanted there. Our preference is to address a person in our region who requires the liver, but the number one criteria is how sick is the recipient. So a local person who's not as sick as somebody who's in crisis doesn't get the liver ahead of the person in crisis. But the blood groups, generally speaking, need to match. And there are a variety of other proteins that are measured in the cross match, and you can deal with a cross match that isn't perfect, but the risk of rejection goes up. So what you try and do is identify people who are as close to being identical as possible, but generally speaking, a difference in the blood group can be a deal breaker. With the newer drugs that we have for rejection, most of the other issues can be dealt with, even if it's not perfect. The other factor is size. If you have somebody who is really small, then putting a large liver in somebody who's very small technically is just going to be a problem. So those things will limit you.
So is it fair, this might be too much of a generalization, but is it fair to say it's even as much as a 50-50 chance that a liver and a donor could match?
Oh, unless you have a quite an uncommon blood group, and AB is the most uncommon one that we deal with, the chances that if you donate a liver, there's going to be somebody that could benefit from that is just about 100%. Just about 100.
Wow.
And what we have done is, in some cases, we've gone to the United States. So rather than having an organ that gets donated not be used by anybody, Atlantic Canada would be our first preference. If not, then somebody else in Canada. And if nobody in Canada would be a match, I remember a team some years ago, we had a young 17-year-old girl who was a donor, but she had a very uncommon blood group. And so a team from New York came. And it was much better to save somebody's life in New York and honor that gift of donation than to just lose that opportunity.
Absolutely. Oh my gosh. We did have one more question. If the donor had heart disease, would they qualify to donate if they are a match?
That's a great question because it comes up all the time. If I have a medical problem, does that mean I can't be a donor? And it depends on the medical problem. But if you have significant heart disease and everything else works pretty well, then you absolutely can donate other organs. We will do a very complete medical review in anybody that is a potential donor. And we've had patients. I distinctly remember a woman who was transferred in who had inoperable coronary artery disease. She had huge pneumonia. She was on dialysis, and she had a giant bleed into her brain. I mean, everything was terrible, but her family said she's one of those people that just wants to help everybody. She would want to help everybody. And on first glance, I looked at her and said, this poor woman is so sick. What are we going to do? Well, she had a liver that was absolutely perfect. It was transplanted, and the transplant recipient was in and out of the ICU in less than 24 hours. So a very complete assessment will be made of any potential donor. And if you have a medical condition that affects one organ, it doesn't mean a different organ couldn't be used.
What a story. Like I'm welling up here to hear these stories like this because it just hits me right in the feels. We had someone ask that this is fascinating. I have a BHR negative blood type. Is that a factor for donation? Thank you, Sylvia.
It would be fine. B is a less common blood group, but there would be lots of people in Atlantic Canada or Central Canada who would be Group B, and the chance that you could be a donor would be, based on blood group, would be basically 100%.
Yay, Sylvia. Well, gentlemen, I just want to say thank you so much for taking the time to be here this evening. This has been incredibly informative and uplifting. Did you have anything else you wanted to end before we wrapped up here, Craig and Rod?
Well, happy Valentine's Day, everybody.
Spread love.
Spread the love. And thank you, Alicia, for doing this. Really, it's our pleasure to be here. Yeah.
Thank you. And Dr. B, thank you so much for taking the time. I can only imagine how busy your schedule is on a normal day, let alone in the current health crisis we're in.
Well, I'm happy to do it. And I think that if we can provide comfort for people in the worst days of their life, then we should do it. And if that's going to, this is one of those very rare things. If we think about improving donation, it is clearly a benefit to the recipients. It's life-saving, life-changing. It's clearly a benefit to the family who've gone through the worst thing you can imagine. And interestingly, it is an enormous financial gain for the system. The financial benefit, I hate to break it down to dollars and cents, but the reality is if you transplant a single kidney, that results in about a $300,000 savings to the healthcare system. So we have a desire to improve donation because it's the right thing from a human point of view for the donor family, for the recipients, but interestingly enough, it's also better for the system. So we'll do what we can do to make our system the best in the country. I want to be able to tell everybody we have by far the best donation program. And last year, we had the highest donation rates that have ever been recorded in Canada. And I want to continue that.
Oh my gosh, that's incredible.
Yeah. But the other thing to remember, and this is important, is we had the highest donor rates ever recorded in Canada. And it's still a very rare event. If you look at the entire province in the entire year, we had about 20 donors per year. That's it. So the missed donor opportunity is a big deal. Missing a single donor, if you're only going to have 20 some, is a big deal. If you're going to have 1,000, you don't want to miss one, but there's 999 that will be coming along. We just won't have numbers that high. So missing a single one makes a difference. The other thing I should point out in the context of this is we've talked about organ donation because we did, but tissue donation is life altering. The restrictions on tissue donation are a bit different, but if you're a tissue donor, then we can get between 50 and 70 grafts from a single tissue donor that can change somebody's life. And so the tissue donation that we're talking about is bone, is very, very commonly donated. And many, many people that have had orthopedic procedures or oral surgery procedures have probably received a bone graft and they may not know it. But tissue donation for bone is very common. For skin, for burn patients, is life-saving. For heart valves, especially for pediatric patients, tendons, and corneas. There's lots of people who are blind but get their sight back when we transplant a cornea. And
my God.
So we want to make sure that people think about tissue donation as well.
That I can't even imagine that experience for somebody who gets a cornea transplant and then has vision. I mean,
yes.
I was blown away by the diabetes, but this is next level.
Well, talk to somebody that was blind and now they see. It's life-changing.
My God, the more you know. Well, thank you so very much for enlightening us on the importance of organ and tissue donation today on National Organ Donor Day and every day. And I certainly hope this was a huge eye-opener to the people that we had viewing, and we'll see this video after we're done going live. Thank you so much, Dr. Bede.
Happy to help. And happy Valentine's Day, and thank you for the invitation.
Oh gosh, we're too happy to have you here. And if you missed it in the beginning, you're going to be seeing a lot more of Craig, and hopefully that means we're going to see a lot more of Rod too around the Hive and Churro Buzz as our newest Churro Buzz employees. Can't wait.
Okay.
Can't wait.
Awesome. Hang in there for just a second, guys. And thank you so much, everyone who joined tonight to watch this and commented. We really appreciate it. Happy Valentine's Day to you and the beginning of Random Acts of Kindness Week. We're going to be doing giveaways to our followers all week. So stay tuned for that. We'll do an announcement tomorrow. Have a wonderful week and enjoy your holiday tomorrow. Okay.
Thank you.